Do you often feel like your child keeps getting sick, like colds, ear infections, or lung problems, even after taking medicines? What if their body just can't fight germs like other kids? That's what happens in X-linked Agammaglobulinemia, also called Bruton's disease. It's a rare problem where the body can't make important germ-fighting soldiers, called antibodies. Think of antibodies like superhero shields that protect you from viruses and bacteria. Without them, even small bugs can cause big sicknesses. And guess what? This disease mostly affects boys because it travels through the X gene, passed usually from mom to son. So if a boy seems to get sick every few weeks, especially after 6 months of age, this might be why. What causes this? It's because of a broken instruction in the body's building plan, your genes. Specifically, a gene on the X chromosome called BTK, Bruton's tyrosine kinase, is damaged. This gene is like a construction manager for making B cells, the cells that turn into antibody factories. When the BTK gene isn't working, the body can't build B cells. No B cells means no antibodies. Since boys have only one X chromosome, they are XY. If that one X has the broken gene, they get the disease. Girls have two XS, XX, so even if one is broken, the other can cover it. That's why girls rarely get sick from this, but they can carry the gene and pass it to their kids. Imagine building a car but missing the engine blueprint. No matter how hard you try, the car won't run. That's what happens here. So, how do you know if someone has this condition? Most babies seem fine at first because they borrow mom's antibodies before birth. But around 6 months, those borrowed shields disappear, and then the trouble starts. The child might get ear infections, sinus problems, or pneumonia again and again. They may have bad diarrhea from weak gut defenses. Some even get dangerous infections, like meningitis. You might notice they don't have tonsils or lymph nodes. Try feeling gently on the sides of their neck. Normal kids have small bumps, lymph nodes, but kids with this disease often do. Also, common vaccines that use live viruses, like the oral polio vaccine, can actually make them sick. So if a boy is frequently ill after 6 months, with no tonsils and weak responses to bugs, it's a big red flag. How do doctors find out? They run blood tests. First, they check for B cells. Usually, they're missing or very low. Then they test antibody levels IgG, IgM, IgA. All are very low or gone. If a boy has almost no B cells and no antibodies, doctors strongly suspect Bruton's disease. A gene test can confirm the broken BTK gene. Now, is there a cure? Not yet, but there is a strong treatment: immunoglobulin replacement therapy. This means giving the missing antibodies from healthy donors through IV or under the skin. Think of it like refilling the body's shield supply every few weeks. With regular treatments, most boys live active, healthy lives. But they must avoid live vaccines and take antibiotics quickly if infected. Early diagnosis and treatment are key, like fixing a leaky boat before it sinks. Can we stop it before it starts? Not the gene damage itself, but we can prevent harm. If a family has a history, genetic counseling helps. Doctors can test pregnant mothers to see if the baby carries the gene. Newborn screening isn't common yet, but some places are starting to test for low B cells in boys. The best prevention is early detection. Also, families should know, no live vaccines, like rotavirus or nasal flu spray, for these kids. Simple hygiene, hand washing, clean water, avoiding sick people, helps a lot. It's like living in a germ-safe bubble. Parents can work with doctors to create a health plan so their child stays strong and safe. Good news, science is moving forward. Researchers are testing gene therapy, where they fix the broken BTK gene in the child's own cells. In labs, they take stem cells, correct the gene, and put them back, like fixing the engine blueprint and rebuilding the car. Early trials in animals and early human cases show B cells can come back. Also, new types of antibody treatments last longer, so fewer infusions are needed. Some scientists are even exploring pills to boost weak immune pathways. While these aren't standard yet, they offer hope for a future where kids won't just manage the disease, they could be cured. Imagine a world where one treatment fixes the root cause. That day might be closer than we think.